even though you know your body, and I appreciate you paying attention to what you're feeling physically, there's a thing called hypoglycemic unawareness. And what happens when your sugars are up high for a longer period of time, as duration, as time goes on with you having type 2 diabetes, it starts dropping down. And you don't realize it drops down because you're starting to get those highs and lows all the time, and it's becoming normal. So when you're getting down to a normal person, their blood sugar levels are normally between 80 and 120, and that's including being fed. So not just a fasted state. So I'm talking about being in a fed state also. So once you get down to below 70, once you get to about 60 something, your body starts kicking in these other hormones. You know what insulin is, obviously. So we have counter-regulatory hormones. We have 4 hormones that counter-regulate insulin. Whatever insulin does to counter it. So glucagon being one of them. So insulin's job is to get the blood sugar out of your blood and into your cells. But then you start getting down lower and lower. And if you don't feel like you're starting to get faint or dizzy or anything, or you're not feeling like tingleness or headaches or dizziness or anything like that, you could still be down in a hypoglycemic state and not even know it. We have one member who is down continuously in the 40s, and that becomes life-threatening. And she doesn't even realize it until she hits below a 40. So pricking the finger, unfortunately, is something I would recommend. And I know you don't want to hear it. I wouldn't want to do it either. But this is one of the things to look forward to, not having to worry about doing that once you start getting your body to start working the way it's supposed to be working. So our bodies are designed to heal itself. So if you start giving the body the raw materials it needs to heal itself, it will. The medications, as you say, one of our members in here, she was taking a lot of this, like 400 units of insulin. And she would wake up in the middle of the night with her blood sugars being super low. So then she would eat some sugar to bring her blood sugars back up. But in essence, what she was doing is that she was feeding the medications so that she could stay on the medications. And that's the way that our healthcare system is designed. It's designed to where they make you eat a certain way to keep you on those medications. And if you don't eat that way, then those medications are going to make you go into a hypoglycemic state. So you're doing the right thing of paying attention to your body and trying to avoid medications. I'm not saying, I can't tell you to go on the medications, to get off the medications. I can't tell you any of that stuff. But do whatever you think. I would like to know where your blood sugar levels are, though. As much as you don't want to prick, we need to know where you are. The A1C, unfortunately, the way that the United States is designed, we're a capitalistic country. And the pharmaceutical industry regulates the healthcare system. So whatever they say, the healthcare system does, because that's who has all the money, is the pharmaceutical industry. So there's testing that you could have done years and years and years ago. 13 years, they show that out 13 years before you become a diabetic, it can show you that you're starting to lead into diabetes because of these tests that you can do instead of the A1C. I would still recommend the A1C, but the fasting blood glucose, you're saying that your doctor didn't tell you that you're pre-diabetic. What they do is they do the fasting blood sugar test when you're in a fasted state, but blood sugar is the last thing that comes up. Your insulin shoots up 13, 14 years before your blood sugar starts shooting up. And insulin, what they're doing, what your pancreas is trying to do is that your blood sugar levels are up way too high. So your body knows that it's dangerous and it could kill you. So what it does, it releases more and more insulin to get that blood sugar back down. And once you keep doing it year after year after year after year, your pancreas starts wearing out and you can't produce as much insulin as it once did. And that's when your blood sugar level goes up. So you've had problems years and years before you're even diagnosed. It's just the way that we test it over here. They wait until you have a problem, say, we have a drug for you. And then they keep you on that drug, as you say, for the rest of your life. So, yeah, so there's different tests that I would ask you to do to see where you're at. And this is how I figure out what kind of strategy we can use for you, what we need to do to help get your blood sugar levels down and get you off all the medications to become non-diabetic. is we do a lot of blood work, because that's the only way we figure out what's going on inside you is with the blood work. So as Jovi knows, we do lots and lots of different hormonal tests, and it's the hormones that dictate what's going to happen with your body. It's not calories. Your doctor tells you to cut calories out, and they tell you to eat more carbs when you should be eating less. You should be eating more fat, but we had this fat, as you lived through, the whole low fat craze, because fat causes heart attacks. And it's not true. It's the sugar that's causing all the heart attacks and strokes, because all that builds up inside your blood sugar, inside your veins, and it starts ruining your veins. So the cholesterol and saturated fat has to go in there to patch up those holes. And then when they test for you, that's what they see. They don't see the sugar, because that's been gone for a long time. It's the cholesterol that's trying to repair what the sugar's been doing. So everything is ass backwards. So we need to recorrect that and reformulate your mind into getting off the what the doctors have been telling you. And it sounds like that you're already there. You want to stay away from what the doctors are saying and try something new. And what we've been doing for the last 2 years, I've been doing it for 22 years, but I just kind of like formally went into a kind of group like this 2 years ago. And I don't think anybody in the group has gotten worse since we've been together. Everybody's gotten better, and the group is getting bigger because word of mouth, and people are starting to realize that this is not a lifelong disease like you guys have been told for 30, 40 years. It's not a progressive disease if you know how to stop it from happening, progressing. So getting out the medications, weaning yourself out of medications with the help of your doctor. You can't do it on your own. You need your doctor to work with you. And if your doctor doesn't want to work with you, we have a doctor that will help until you do find a doctor that will work with you.